Hello everyone, my name's Wise. I'm a physiotherapist at Strength & U Mississauga, your fitness and therapy experts. So today I have with me Stefania.
Hi, my name is Stefania. I'm a volleyball player and I love to run cross country.
And she's in with a common condition that many people suffer from called shin splints. Shin splints are a common condition that come from overuse and repetitive exercises such as jumping and running. So shin splints is caused when there is an overload of the tissue attached to the tibia, resulting in inflammation in the area, which can cause pain. The pain is usually most after exercise. When the person starts exercising, the pain will decrease. So if you have a decrease in pain during the exercise and then an increase in pain after the exercise, that's most likely shin splints. It differs from other conditions like compartment syndrome in that there are no neurological deficits in the leg. It can also mimic stress fractures, which is another overuse injury usually seen in runners where there's small fractures in the tibia. Predisposing factors for people who suffer from shin splints are flat-footedness or pronated feet, muscle imbalances in the lower extremity, and inflexibility in certain muscles such as the calf muscle. A reliable method for testing for shin splints is simply palpating or feeling through the middle side of the shin and feeling for any pain. People who suffer from shin splints usually have weakness in their tib post. The tib post does this motion, and it is very important when someone's taking a step. It slowly lowers the foot down and controls the foot down motion when you're walking, and obviously your tib anterior does the opposite and brings it up like this. So right now I'm going to strength test Steph's tib post to see if there's any weakness and if it's causing or adding to her pain. So you're just going to hold the foot like this, and then I'm going to ask her to hold her position for 5 seconds, and I'm going to resist this movement. And hold. So we see some weakness and caused her some pain, and we can verify that this muscle is also part of her pain experience. So the peroneal group of muscles is on the outside of the leg, and when they are tight, causes people's feet to stay in this position, which is a pronated flat-footed position. Releasing these muscles will help eliminate that tightness and allow the foot to sit in a more neutral position. You can also strength test this muscle here, and usually people with a weak tib post will have strength through these muscles, or a stronger side on these muscles. So you're just gonna hold here, and I'm gonna push. You're gonna hold this position for 5 seconds, don't let me move you. And as we can see, this doesn't cause her any pain, and it's very strong. So now we're gonna start the treatment. She has been experiencing a lot of inflammation and pain in the area of the tib post and medial tibia. So what we're gonna do is some soft tissue work to decrease the tension in the area and reduce the pain that she's experiencing. So the first one we're gonna do is releasing the tib post. So you're going to be holding here, and you're just going to try to stretch the muscle or do the opposite motion of what it does. Because the tib post does this motion, what you're gonna do is hold the muscle down and stretch it the opposite way. And this might be a little painful for people with shin splints, but it'll decrease their pain in the long run. So that specific technique will decrease adhesions in the area, decrease tension in the tib post, and reduce the pain that she's experiencing. So next, we'll be working on the flexor hallucis longus, which is basically the muscle that bends your big toe this way, and it's gonna be found on the bottom of the foot, right near the middle of your arch. And this can cause a lot of pain for people with shin splints as well. So I'll be stretching this muscle by pinning down the tendon and doing the opposite motion that the muscle does again. So bringing the toe towards the client. And this can be a little sore and tight for people as well. So next we're gonna be working on the peroneals, trying to reduce tension in the lateral side of the leg. So from here, we'll go just under the fibular head where the peroneus longus attaches, and then again, do the opposite motion of what the muscle does. So pin it down and stretch it out. And you can go all the way along. This might be sore for people who have tightness in the area, and we're just reducing the adhesions in the area and reducing muscle tension in the area. Another effective treatment for shin splints is shockwave therapy. It is applied in the area where the client is feeling their inflammation and pain, and it'll help decrease tension in the area, break down adhesions, and help reduce tightness in the fascia and in the muscle groups connected to the tibia. We saw that Stefania had some weakness in her tib post, and one simple exercise that we can prescribe to take home to strengthen that tib post is walking on your tippy toes. So I've instructed Stefania to not just walk on all of her tippy toes, but bias it towards pointing toes toward the middle. Another exercise we can prescribe for the home exercise program is using your foot intrinsics. So giving something like a napkin or a towel on the ground and trying to grab it with your feet. That will help strengthen the muscles in the foot and help improve the client's arch. So the last thing that we covered during our session is activity modifications that are going to be important in reducing the pain and preventing further injury. The first modification that we spoke about together at the end of our session is changing the running shoes, because it's important to make sure that you're running with appropriate footwear and running with footwear that is not going to cause a further injury. So the second activity modification we spoke about is for Stefania to consider the terrain or the surfaces that she's running on. We want her to run on even surfaces, whether it be a track at a school near her house or on a dirt trail. We want to avoid uneven surfaces that may overload or increase the stress that her muscles or joints experience. The last and one of the most important things that we spoke about was running form and running retraining, so that she can learn to run in a way that uses her muscles correctly and will not increase her risk of injury. That concludes our session for today. If you have experienced any of the pain or symptoms that we spoke about, hit us up at Strength in You Mississauga. My name is Wise. I'm a physiotherapist at Strength in You Mississauga, and now you're one more strategy away from crushing your fitness goals.